The Kenya Medical Supplies Agency, that's KEMSA, has once again been put on the spot by international donors, with the head of the Global Fund, Mark Edington, asking the government to fully commit itself in ensuring the medical supplier undergoes positive reforms. This came up during a virtual meeting of the signing of a 48 billion shillings grant from Global Fund that will see Kenya address issues around HIV and AIDS, malaria and tuberculosis. Raquel Mugai has more details.
HIV, AIDS, malaria and tuberculosis programs have for the best part been successful here in the country, largely owing to donor funding. The Global Fund this time round giving Kenya yet another boost, a 48 billion shillings grant to cater for the programs through 2021 to 2024.
We hope to achieve comprehensive prevention, treatment and care for people infected with HIV, TB, leprosy, lung disease, and as well as reduce malaria incidence deaths by at least 75% of the 216 levels by 2023.
Community health services, as you've seen, are the ones that actually make this grant work. Whether it's HIV, TB, malaria, community health services are critical towards achieving universal health coverage.
The money, which amounts to $441.5 million, will be distributed to the recipients, which include the National Treasury, which will be issued with $294 million for HIV, TB and malaria, $70 million to Amref Health Africa for TB and malaria, and $76 million to Kenya Red Cross Society for HIV program.
We urge the National Treasury, as the principal recipient of Global Fund, to ensure timely disbursement of funds for purposes of timely implementation of these critical activities.
However, the state of the Kenya Medical Supplies Agency, KEMSA, a principal recipient of the Global Fund, is one that featured during the virtual signing of the grant. Mark Edington, the head at the Global Fund, stating in quote, "It is important that we have commitments as a government in the ongoing reforms at the Kenya Medical Supplies Agency. We request the government to pay urgent attention and put in place mitigation measures to procure equipment and drugs occasioned by the delays. We will be reaching out to the Auditor General to obtain clarification on the auditing process." Earlier this year, KEMSA was put on the spot after ARV medication donated by USAID was stuck at the Mombasa port since January, after what USAID claimed to be lack of confidence in the drug agency. The delay saw persons living with HIV change their medication schedules to deal with the supply challenges.
It is our belief that domestic financing will be a major contributor to bridging some of this gap, e.g. commodity security and functional programs like psychosocial support group for adolescents and young people living with HIV in Kenya.
The grant comes barely weeks after the Auditor's General report indicated that Kenya was yet to utilize 1 billion shillings of a Global Fund-sponsored project on expanding HIV prevention, care and treatment services for the period 2015 to 2017, owing to delayed disbursements. The Auditor's report citing that the money will most likely be refunded to the donor. With those in the health sector hoping that these funds will be timely disbursed to ensure implementation of the said programs, the state of the Kenya Medical Supplies Agency remains a key factor in the relationship between Kenya and its donors, given the role it plays in the country's health system. Raquel Mugai, Citizen TV, Nairobi.